This conference will now be recorded.
We'll get started in just a moment or two here. People are just coming on right now. Welcome, everyone. Let's give it another 30 seconds or so. I see the numbers are ticking up here. About 19 people on right now. All right, so it's just about a minute after our start time, and I know we have a lot to cover in a very short amount of time, so we'll go ahead and get started, and people can join us as they want to come on board. So first, my name is Tom Hopcroft. Welcome. I'm the president and CEO of Mass TLC. This is our COVID-19 impact business guidance briefing and peer discussion. I want to say just at the outset that we are recording this program for people who aren't able to join us live. So, you know, if you're asking questions, know that it may be made available online later. So, as we get started, Mackenzie, if you can flip our slide here, I'd like to first start out by thanking all of our global sponsors. These are the organizations who really help underwrite the work that we do throughout the year, and we thank them not only for their financial support, but for their time and thought leadership that they provide to the work that we do. And with that, I want to move on to really get into today's program. We are really fortunate today to have two speakers. You know, Adam Foreman and Stephen Melnick are both with the law firm Littler, which is the largest labor and employment law firm in the world. And so we're really pleased to have them to be able to share their expertise. I want to note that up on the Mass TLC website, we also have links to articles that, a couple articles they have produced and an FAQ that has a lot more detail that we'll be able to cover in our time here on the phone or on the internet. Also, if you mute your microphones, that'll help throughout the program as well. In the registration, we did ask you what the most timely and important issues are to you, and health and safety, wage and hour issues certainly came out, and we'll cover those, as well as some new legislation will be coming as well. In terms of format, Adam and Steve are going to walk us through a few of these issues. We do want to make this as interactive as possible. And again, if people's mics are open when they're not speaking, if they could keep those on mute, that would be great. There, you'll notice on the upper right-hand corner of your screen, there's a little circle that looks like a word or text bubble that might be above you in a cartoon. If you click on that, that'll open the chat window on the right. And given the number of people we have on the call, we'd like to ask you, if you have questions, to please put the question in the chat field, and Mackenzie on my team will read out the questions. We'll try to find a moment to break in and read the questions as we go, and in that way we can keep things a little bit more orderly as we go through the presentation. But with that, we now have, it looks like, about 28 people on the call. A few more may join us, but I'd like to turn it over to Adam to kick us off.
All right, thank you, Tom, and thank you everybody for joining. Steve and I are going to divide labor in the following way. I'm going to handle the health and safety issues, and then Steve is going to handle the wage and hour issues, which will include issues such as if you have to reduce pay for your employees, consider furloughs, consider reductions in force. And then at the end, we will cover the new legislation that was signed into law by President Trump last night. So starting with the, and as Tom said, we'd like it to be as interactive as possible. So if you have any questions as I go along or as Steve goes along, please send them and Mackenzie will interrupt us and read the questions so that everyone on the webinar can share, because I'm sure if you have that question, others have the same question. So here we go. What I'm going to do and I'm actually going to put a timer on to make sure that I don't blab on and on. What I'm going to do for about the next 7 minutes, 5 to 7 minutes, is just outline some health and safety issues that you should be thinking about. I'm going to move fairly quickly to leave time for Steve to cover what I think is actually the more timely issue, which is the wage and hour issues. But please interrupt me if you have questions as I'm talking, and of course at the end there's time set aside for questions. So first issue, actually, observation. The health and safety issues are becoming less and less relevant as time passes. And the reason they're becoming less and less relevant is that more of us are working remotely. And so as time passes with us working remotely, there's less and less risk of these health and safety issues. So what I'm talking about was certainly very relevant 2 weeks ago, even last week, becoming slightly less relevant this week, and a week or two from now probably won't be that relevant at all. But here we go. Number one, travel restrictions. So the issue is, can you as a business restrict your folks from traveling? Because of course, if they travel, it increases the risk that they will become infected and then spread it to others. The answer is you can restrict business travel. You can make, you can, as Littler has itself, issue a mandate that there will be no business travel for the foreseeable future. But if you have employees that you feel that it's essential to the health of the business that they do travel, then the question becomes, can you compel self-quarantine rather than having return immediately to the office? And the answer is you can compel self-quarantine, but because you are the ones who mandated that they would travel, they should be paid for that self-quarantine time. Now that's in comparison to personal travel, where somebody's not working, but they've opted for personal reasons to travel. Can you compel them not to travel? Can you forbid it? It's personal time, so it's really not, you don't have any way of policing it. You don't have any real way of enforcing it as a practical matter. We don't see a lot of a win in there for employers to try to control what people do on their personal time. But what we can say is that there will be a consequence if the employee does travel. They need to disclose that they've traveled. At this point, travel anywhere, not just internationally. If they've traveled out of state, then you can impose a self-quarantine. And here, because it was for personal travel, you do not have to pay for the self-quarantine. One special note about FMLA, if somebody is traveling, in this case, it could be abroad or get on a plane to travel to California because they have a family member, a parent, a son, daughter, a spouse who is sick, and they need to provide care for that designated family member, then that absence may be FMLA protected, and therefore engaging in any form of discipline because the employee chose to travel would be forbidden by the FMLA. So again, it doesn't mean you can't force them to self-quarantine, but you can't give them a written warning or terminate them because they traveled for FMLA reasons. Another issue that is going to become less and less important as time passes and people have been working remotely will be, what do you do if an employee tests positive? So first, if the employee tests positive, they're going to be eligible for statutory sick leave, Massachusetts statutory sick leave. They're going to be eligible for FMLA. They're going to be eligible for STD. And now they're also going to be eligible for the new federal paid sick leave. So practical questions for you as the employer. What do you do about notifying others in the workplace that you have somebody who has tested positive? Should you notify others? Well, the CDC has said that yes, you should be notifying others in the workplace if somebody has been tested positive, but the CDC also says you should be paying careful attention to protecting the privacy of the person who has tested privacy. So how do you balance that? How do you balance notifying the workforce that somebody's tested positive, but at the same time protecting somebody's privacy? Turns out for clients that have had this problem arise so far, it's not easy. And so two things to think about. One is, are you going to send a general notice to the workplace or to the specific office this person works in? Or are you going to just limit it to those who you think might have had contact with the employee? The better practice is to send a general notice to the relevant office to say someone in the office has tested positive. We just wanted you to be aware. We're taking appropriate steps and measures. And you should further add, we will be sending out a specific notice to those to whom we think this person has had contact with in the last 14 days. Again, becomes less and less relevant the longer people have been working remotely. So in order to be able to make that representation, we will be reaching out to those who we think may have had contact. That means you're going to need to be in communication with the person who has tested positive. You're going to need to get from them who they think that they were meeting with, who they had contact with in the last 14 days. If for some reason they're not reachable, maybe because they're already very sick, then you need to talk to that person's manager and use your best judgment about who to reach out to. And the best practice is not to disclose the name of the person who tested positive, but rather to notify these people that when they were reporting to work, they were in contact with somebody who did test positive. Sometimes it just, because of the size of the office, it kind of gives away who it is, but you really have no choice, and you've done as much as you can to protect their privacy. What do you do if you still have people reporting to work and you want to do temperature checks? Because one of the common symptoms of the virus is somebody who has a fever of 100.4 or above. And so the EEOC prior to the pandemic said you shouldn't be doing it because it's an overly broad medical examination under the ADA, but the EEOC recently issued a guidance saying, well, the CDC has declared that it is a pandemic, and so we're reversing our position, and as long as you don't administer the test in a discriminatory fashion, you can in fact do temperature checks of your employees. A couple things to think about. You want to have some kind of protocol. You don't want to just jump into it. You need to think about the following. Who's going to be responsible for doing the testing? You know, how you're going to make sure that they're trained and to think about all the safety issues. So related to that, what measures are you going to take to help make sure this person doesn't get infected? Are you going to provide them with gloves? Are you going to provide them with a mask? Are you going to provide them with some kind of smock that they can take off at the end of the day that will be cleaned? Can you get a scanner to do the temperature checks as opposed to an old-fashioned thermometer? Because the scanner will help avoid contact with the employees who are being tested. What location are you going to do the testing in? Because you run the risk of a privacy issue. If somebody tests temperature is 100.4 or above, and so they're going to be sent away, and there's a long line of people waiting to be tested, are you going to make them walk that line of shame as they leave the office? That's a privacy issue, right? So you need to figure out how you're going to set up the location so that you're not giving away who actually has tested for having a temperature. When are you going to do the testing? Is it going to be the same time every day, and when will that be? What if an employee refuses to be tested? So there, the response is that you can't enter our facility if you haven't been tested, so you're going to be sent home. You probably give them one free bite at the apple, let them go home without being disciplined for that day. But on day 2, they're required to come back. And if they still refuse to be tested, then they can be disciplined and or terminated because it's a requirement of the job that they be tested. And then finally, make sure you're taking measures to protect the privacy of whatever you learn from the temperature check, because it's still governed by the ADA confidentiality rules. So make sure only those with a need to know have access to any records you're creating, and consider maybe actually destroying those records after a certain period of time, because it will only be relevant for what, a 14-day period of time or so. You can implement similar types of restrictions for visitors and contractors and vendors as well. And then finally, and I'm going to hand it over to Steve, the last issue is, what do you do about an employee who's still being asked to report to work, who says, I'm in an at-risk category, so I don't want to report to work because it'll put me close in proximity to people and I could get sick. The CDC is encouraging employers to let those people work remotely, and if they can't work remotely, then the CDC is just recommending you give them permission to stay home. It doesn't address, the CDC doesn't speak to the issue of whether you pay them or not. But I think you're fighting an uphill battle if you have somebody who's pregnant, if you have somebody who suffers from pre-existing respiratory issues, if somebody has cancer and is going through treatments. I think you're fighting an uphill battle by compelling them to continue to come to work. So those are some of the highlighted issues. Unless you have any questions, I am going to turn it over to Steve.
All right, thanks very much, Adam. So my section of this presentation is going to be talking about how are we going to weather the extraordinary times while remaining compliant with employment laws, primarily wage and hour laws, but also laws regarding leave and sick time. There's certainly a range of options that employers have right now, ranging from business as usual, telecommuting.
It's a little bit hard to hear you right now, Steve.
Is that any better?
It's not Can we maybe, do you want to try dialing in on the phone number as well? Just so we get better audio.
Yeah, I can try that. Apologies.
Yeah, and then you'll have to mute the computer.
Yeah.
So Steve, while you're trying to call in, I'll just quickly pick up. So what Steve was saying is that you have a range of options, from continuing to pay your folks, from if you have cash flow issues, implementing pay cuts, to the far extreme are reductions in force. The compromise in the middle is a furlough, which is preserving the employment relationship with your folks, but you're basically putting them into inactive status. So they're not going to be paid for the length of the furlough, but they would hopefully remain eligible to continue to participate in your benefits programs. You will need to check with your broker to confirm that while somebody's in inactive status, which is really analogous to being on a medical leave of absence, right? They're the same kind of thing. But you want to confirm that they will in fact remain eligible for benefits under your particular programs while on the furlough. One of the practical questions for the furlough is, fine, their benefits eligible, but if they have to pay a portion of the monthly health insurance premium, how are they going to do it, since while furloughed, they're not being paid? So where are they going to get the money to pay their 30% of the monthly health insurance? What most companies are opting to do for the length of the furlough is just to pay 100% of the premium, and they're not going to seek it back. It's still a heck of a lot cheaper than paying the full payroll during that period of time. Steve, are you on?
Testing. How's that sound?
Oh yeah,
That's
much
good.
better. All right, so I just
apologies for that.
Hey Steve, you might just mute your computer while you're on the phone.
Yeah,
Computer should be muted right now, so shouldn't have any feedback.
Good.
Apologies for that. So, Adam, I think you were just talking about furloughs.
So what I did is I just outlined what the spectrum were. I didn't get into great detail about any of the possible options.
Got it. Okay. So might as well start with telecommuting, which is obviously what I'm doing right now, coming to you from the basement of Whitwer Mendelson's Metro West office. And I'm pretty sure I see some other people on the screen. Looks like everyone else is telecommuting as well. Some of the issues that you have to think about for when we're doing telecommuting, for non-exempt employees, they have to make sure that these are hourly employees who are not exempt from overtime. You have to make sure that they're tracking their hours accurately, which is a difficult thing to do when someone's at home and can be doing whatever they want. It's somewhat of an honor system right now, but people are, and it has to be clearly communicated to them that they are expected to be tracking all their hours as they go. Employees cannot work off the clock. So I'd recommend for non-exempt employees that they be given a clear start and stop time, that your day starts at 9, your day ends at 5. You're going to be working during that time, and you're not going to work at 8:55, and you're not going to work at 5:15. Just keep it within that time. If the person is working outside that period, make sure that they're recording it so they can be paid for it. And even though people are working from home, they still have to take their meal breaks. So if a person in Massachusetts is working more than 6 hours during a day, they still have to take at least 30 minutes unpaid with no work during the middle of the day. So make sure employees are aware of that, that they are expected to still be taking their meal breaks. Telecommuting for exempt employees, not a problem from a wage and hour perspective. One question that does come up for all employees is reimbursement. Do you have to pay for the person's internet, their cell phone, things of that nature? Under Massachusetts law, that's not required. Probably every now and then we get a case that's saying where the plaintiff will say that they should be reimbursed for business expenses. There's no statute or regulation specifically requiring that. But as a best practice at this time, you may consider offering some kind of stipend or something of that nature to help defray the costs if people are, using up all their data on their cell phones or, something of that nature. Work from home, telecommuting, remote working, make sure it's being done consistently, as with everything, that you're not applying any kind of discriminatory manner. Be very mindful of cybersecurity and confidentiality issues. People shouldn't be just using their Gmail or their Hotmail or whatever to conduct business. If possible, they should be going through a VPN and using your secure networks. Make sure people are aware not to just leave sensitive, confidential, private information just lying around on their desk or on their kitchen table, things of that nature. And last but not least, with respect to telecommuting, you should probably have a policy in place. If you don't have one now, send one out, or at least a directive saying, here is what we expect of you, so employees know this is what they have to do and how they have to do it during these extraordinary times. And if you do have a policy, you might want to consider looking at it again, seeing if there's anything in it that needs to be dusted off or updated. The next in the range of options or menu of options is reducing hours or reducing wages. First, that has to be done in advance. You can't do it retroactively. You can't say, oh, we're cutting your pay for the last 2 pay periods, anything of that nature. It has to be forward-looking. Preferably, it should be for the next pay period. Would probably be the most ideal way to do it. But as much notice as you can give is what you should offer. Non-exempt employees, hourly employees, it's pretty simple. You just pay them what they work. If they are working fewer hours, you pay them fewer wages. And you can set their wages pretty much anywhere you want, prospectively, as long as it's above the minimum wage of $12 an hour. Exempt employees, it's a little more tricky. The law on this is not very clear on whether you can reduce salaries or not. I think generally if you're reducing salaries but not reducing hours, that's probably okay. If you're reducing salaries and hours, it might look like the person's really an hourly worker and therefore should be entitled to overtime. Also, it should be a more long-term change. It shouldn't be done on a week-to-week or more frequent basis. Preferably, if you're going to change or reduce an exempt employee's salary, it should be probably for a month or more, just to show that it is a bona fide reduction in salary and not a just reduction in what might be seen as an hourly wage, which would be inconsistent with how an exempt employee is paid. Also be mindful of things like bonuses, incentive comp, commissions. Can you modify those? It depends on whether it's been earned or not. For a full year bonus, if your bonus plan says that you can modify it, you might want to consider doing that. If we just don't have the cash flow to pay for a bonus, you might say, look, bonuses are going to be reduced for this year. If it's a quarterly bonus and we've already gone through Q1, or we've mostly gone through Q1, it's going to be a lot more difficult to reduce that bonus on a going forward basis. Furloughs would be your next option. So that's telling employees, you got to go home, we're cutting your hours to 0, and we're not going to be able to pay you for this time period. Again, non-exempt employees, that's fairly straightforward. You just don't pay them. If they're not working the hours, you don't have to pay them. Exempt employees, salaried employees, you have to pay either a full week or no week at all. If a salaried employee works any time whatsoever during a week, you have to be paid for that full week. So Jane, the manager, works Monday, Tuesday, you say, sorry, we're shutting down on Wednesday. She still needs to be paid for that full week. Likewise, if a salaried employee is on furlough and they do any work during that week, they can say, hey, I should be paid for that full week. So Jane, the manager, goes home, doesn't work all week, but she checks her email, responds to a few emails, takes home some projects and does a little bit of work here and there. She could say, I need to be paid for that entire week. So if you're furloughing a salaried exempt employee, you should make sure that either they're doing no work whatsoever or you're still paying them. Benefits, I think Adam might have touched on this. It's going to depend on the terms of your benefit plans, whether the person's still entitled to benefits or not. Some benefit plans say you have to be working at least 30 hours a week to be eligible for health insurance, life insurance, whatever. Others have more of a look back period, have you worked so many hours in the past 12 months or things of that nature. That you're going to have to check with either your plans, your benefit people, or your broker to determine how that works. The final option in the menu is just a straight layoff, where you just terminate the person's employment. Keep in mind, if you're terminating an employee, final wages have to be paid on their last day in hand. This includes any accrued unused vacation. Doesn't include sick time, but it does include vacation. You're not required to provide any severance unless there's a severance plan that's already in place. You have to provide the COBRA notice and unemployment notice at the time of termination. And of course, if you terminate the person's gone, they might go find another job. I'm sure people aren't really looking for jobs right now or hiring as much right now, but that's the concern with that. While on the topic
Question for you, Steve?
Yes, please.
So I've got someone asking, can you collect unemployment if you are on furlough, so active but not terminated?
Good question. I'll skip to unemployment, the unemployment section, since that's come up. If employees hours are reduced significantly, more than say a quarter of their regular hours, they can apply for and collect unemployment. So even if you're just reducing hours, reducing pay, the person can apply for unemployment. People on furlough who are getting no pay can definitely receive it. The governor just signed a new bill here in Massachusetts saying usually there was a 1-week waiting period for unemployment. That's being waived. So as soon as a person has their hours reduced or they're no longer working and receiving pay, they can now receive unemployment benefits starting immediately. Employees used to be required to have a work search requirement. That's being interpreted to permit claimants to collect benefits. So I think the government gets that, the agency gets that. There's only so much you can do to look for work right now. They don't want to keep people from receiving unemployment. Unemployment's also available if you're on quarantine, if you're not working because of risk of exposure, or if your workplace is just shut temporarily, so on like a furlough issue. So unemployment benefits are definitely available for workers who have their hours reduced or eliminated. I read that the unemployment agency received 20,000 applications just on Monday alone, which was more than they received an entire month. So it's definitely something that employers are using a lot. There's also a work share program that employers can use where you can go out and Tom Hopcroft with a very timely link right there. You can ask the agency to help defray the costs of the reducing hours, or in lieu of laying people off, you reduce their hours, and then the unemployment picks up some of the additional or the difference in pay. Getting back to layoffs, one thing to keep in mind is the Federal Warrant Act, which says it's a very complicated statute. We could spend an entire hour talking about it, but just to give you the highlights, if you have 100 plus employees and you're either closing down a site with 50 full-time employees terminated, if you are terminating 500 full-time employees, or if you're terminating 50 full-time employees at a site, and that's 33% of the full-time workforce at the site, you have to give at least 60 days notice to those employees. So keep that in mind. Under current circumstances, that's probably going to be impossible. There are various exceptions to that rule, which again are very complicated and I can't really get into in depth. But if you are doing a reduction in force, a layoff, and there's a 30-day period. So if it's 50 employees being terminated within a 30-day period, you might be triggering Warrant Act. You might have to provide additional notice to those employees. Some other issues that come up a lot with respect to time off and the like. PTO vacation time. You probably cannot force an employee who's on leave, furlough, or the like to use their PTO or vacation time, you can offer it, but you can't require if the person's otherwise unpaid, going without pay, to use their PTO vacation. Short-term disability, again, that's going to depend on the terms of your plan or policy. Generally speaking, that's only if the employee themselves get sick and not if they're out on a quarantine, furlough, caring for another person. But again, check your policy plan to see what that says. FMLA is going to apply if the person's caring for themselves or caring for another person. And we'll get to the new emergency FMLA in a minute. Sick time in Massachusetts is somewhat unusual. A lot of states say that you can use sick time for public health emergencies, which this would likely qualify. Massachusetts, strangely enough, does not have that reason. You can take sick time for your own sickness, to care for someone else's sickness, but technically, just because a person's on quarantine, if they're not sick and no one else is sick, you can't use sick time. I think generally the advice is if someone wants to take their sick time, given the circumstances, let them take the sick time. Don't tell them, no, you cannot take it because you're not actually sick. But just understand that it's not a reason, technically under the law and the regulations, it's not a reason to use sick time. I have some questions about paid family medical leave. We're all paying for it, but it doesn't kick in until 2021, so that's not anything that employees can take advantage of, unfortunately, until January 2021. Workers' compensation, I know there's some questions about that. If you get sick at work and can prove that the reason that I was sick was because I was at work, that's considered a industrial disease, quote unquote, and that would be covered by workers' compensation and something that you'd have to report to the insurer. Of course, the question is, how do you prove that employee got sick at work as opposed to at home or anywhere else? It's going to be very difficult to sort out. I'd say if there's any doubt, report it to your insurance carrier. Let the insurance carrier and the department, the workers' compensation agency, sort that out. Better safe than sorry. So now the new, as of I think 12 hours ago, federal statute on sick time and FMLA, emergency FMLA, it only applies to employers, right now it only applies to employers with fewer than 500 employees. It's not clear whether you include subsidiaries, affiliates in that or not. It's a open question that we're still grappling with, and we're hoping that the Department of Labor will provide some insights, but right now it's not clear whether if you have multiple subsidiaries, multiple affiliates, multiple locations and things of that nature, whether you add them all up or not to get to the 500. Assuming you are under 500 employees, there's two requirements in this new statute, and I'll go through it quickly. I think the final bill was something like 90 pages, so there's a lot there. But here's the highlights. There's a paid sick leave program where employees will receive 2 weeks paid sick leave for COVID-19 related reasons. So quarantining, caring for someone who's quarantining, caring for a child whose school is closed, and diagnosis for the coronavirus. And that's up to $511 a day for the self, or $200 a day if you're caring for someone else. There's also a new Emergency Family and Medical Leave Act provision. And the old 50 people within 75 miles, that doesn't apply to this. It's just under 500 employees. They're entitled to 12 weeks of leave. First 10 days unpaid. The remainder is up to two-thirds of wages. There's two-thirds of wages up to $200 a day. And it's only used when the employee is unable to work or remotely work because the child's school or place of child care has been closed or is unavailable. And that only applies to employees who've been employed for at least 30 days. Employers with fewer than 50 employees are going to be able to apply for an exemption to the Department of Labor. It's not clear what's required for that exemption. There's tax credits that are going to be made available to employees who are offering these kinds of leaves. It's not entirely clear how employers are going to be able to get that credit. I understand the administration is going to try to make it available as soon as possible, either making advances so you're not having to wait till 2021 to collect that money. Our interpretation, and again, it's unclear from the law, is that this sick leave and family medical leave has to be in addition to whatever sick leave policies, paid time off policies you're already offering. That includes the Massachusetts sick time. See a question here, I'll just read it off. When you reference the number of employees, is this full-time equivalent or head count? My understanding is it's straight head count, so not full-time equivalents. So if you have, 499 part-time employees and just one full-time, you're going to be over the 500 employee threshold. Last but not least, this goes into effect 2 weeks from today, April 2nd, is when it goes in. One last point, another thing in the news that I just saw, I understand that the Small Business Administration has approved loans for Massachusetts and for any counties contiguous to Massachusetts. I'm not sure exactly what the requirements are for that. I think they're still sorting that out, but that has been approved. So Adam, do you have anything to add about, I guess, any of those points?
So what I would add is just to emphasize something you said, is that typically in the FMLA world, you get to run the various benefits concurrently. So pre-COVID-19, if somebody was FMLA eligible, it would run concurrently with your PTO program. It would run concurrently with short-term disability and workers' compensation, so that that people couldn't sort of manipulate these various types of paid time off to extend their absence. That's not true with these two new paid benefits. So they're not going to, you can't run them concurrently with statutory sick leave, with your PTO, with anything else. And so it's going to extend, as a practical matter, your obligation to pay these people. And so this is a little bit of the cynic in me coming out, which shouldn't be shocking as an employment lawyer and having seen the underbelly of the employment world for so long. I'm scarred. And what I would say is that because this new law doesn't allow you to run these benefits concurrently, it's an added expense to continuing to employ people during these very difficult times. And so, in some ways, it almost creates an incentive to put people on furlough or to lay them off. But I just think it's important to keep in mind they don't run concurrently.
Yep.
All right. Does anybody have any questions for us?
Yeah, we wanted to have some time in the program for people to share, experiences. We can continue to take questions on these and other legal issues that Adam and Stephen have raised. But also wanted to just hear from folks on the call what you're seeing, what you're wrestling with, what you've found that's working. Just an opportunity to ask questions, not just of our experts here, but of our experts who are the other attendees on the call who are working through this. Does anyone have any questions, comments, experiences that they want to share? And I think this would be a time that you could just unclick your mic, as long as we don't have everyone jump in at the same time. I think that'd be fine. Uncharacteristically quiet moment. So while you guys are thinking about this, I wanted to share that at Mass TLC we're actually putting together a part of our website. It's not yet live, that will have a bunch of additional resources, both about what's going on, where we're getting information. We're actually involved in conversations and briefings with the administration at least once a week, sometimes a couple times a week. And so we'll keep trying to flow that information out to you, to our members, and we'll be setting up a place to do that. Additionally, you've noticed that we've moved our programming all to a virtual format. We are also launching a community area on our website. It's called Mass TLC Central. It's actually a separate platform And within that platform, we have a lot of discussion areas, but one of them is an area specifically on business impacts and issues around the COVID-19 crisis. So it's a real focus on the business side. We have information up there about the SBA loan program and about the work share program and some of these other things. So we will get an invite out to you after this call to join that that community, and hope that you would come in and you could share additional thoughts and questions and experiences. A number of our members are very involved in the response, either working with the government or working with their customer bases or doing some other creative things, which we'll try to profile in the coming days and weeks. And if you are also one of those companies who is really helping with the response here, please let us know, because we would like to profile the work that you're doing and help put some wood behind the arrow on that as well. So there's a lot happening over here. Did I buy enough time for people to have any questions yet? Did our experts and Adam and Stephen, I'll give you a minute to think about if there's additional stuff you guys want to cover, but putting out to the rest of the folks on the phone, I think 90% of you had indicated an interest in being able to share and interact with each other, which is why we carved out this time in the program. And perhaps Steve and Adam are so good that they actually covered every question or issue that you might have. But we'll give it another moment here, and then we'll see if there are some others.
See, a question just popped up. What factors do employers typically consider if they are deciding between a reduction of hours or a furlough? Adam, I'll let you pick it up first, and then I'll jump in if there's anything to add.
Yeah, so it usually comes down to how much cash you have in reserve. And so I guess between a furlough and a reduction in force, so I was thinking in the other way around. So here's the thing. Do you want to try to maintain an employment relationship with your folks for as long as possible? Is there an advantage to your business to doing so? For example, when we get through this crisis, as we will, and the economy starts to pick up again, are you concerned that you will lose some of your people if you're not maintaining some type of relationship with them, if you're not pursuing some type of goodwill gesture with them? So the furlough is that middle ground, that compromise. You can't afford to pay them their base wages, but you are continuing to pay for their benefits. You do have this ongoing relationship. You haven't formally ended it, and it doesn't disqualify them from collecting unemployment, so it doesn't have a downside in that respect. So I view furloughs as a compromise between paying and completely ending the relationship. Steve?
Yes, agree with that. And then, yeah, I agree with that completely. And then with respect to, reduction of hours versus furlough, I mean, I think that does come down to one operational, do you need this person to be there working, or can you operate without that person and then save? And of course, the other side of that coin is the cash flow. I'm sure revenues are plummeting for everyone. Can you afford to, pay the person a reduced hours, or do you need to cut that person's hours down to zero? So that's certainly. Yeah.
One thing I would add, and I know everybody knows this, but it's worth repeating, that take no chances. If your cash flow, if your cash and reserves is questionable, do not let somebody work and earn a wage that you cannot cover. If there's any risk that you won't be able to cover the wage, then either furlough or lay them off, because under the Massachusetts wage statute, if somebody works the time, they've earned the wage, and if it's not paid on time, the penalties are draconian. For example, treble damages, interest, attorney's fees, and in rare cases, but possible, criminal prosecution.
And to make it even more scary, the Massachusetts statute says that a president and treasurer of a company are automatically liable for unpaid wages. So even if the company goes belly up, hope that doesn't happen to any of us here. Even if the company is no longer a going concern, goes bankrupt, the employee can still sue the president or treasurer of the company for unpaid wages. So all the more reason to, when in doubt, furlough, say in advance, hey, next Monday, don't have to come into work. We'll let you know when we need you back. But don't run on the hope that you can make payroll if there's a risk that you can't.
Great. Any questions? We'll look over on the chat bar here. Steve and Adam, are there any issues or topics we haven't covered? I know we intentionally went short on the questions to leave more time for the discussion, but are there any other things you want to cover? Otherwise, we can give people a few minutes back to their days.
I don't have anything.
I think we covered it.
All right. Well, then let's wrap it up here, because I don't believe in using extra time that we don't need to use. But we will we'll get information out to you guys on our new online community, and we invite you to share and ask questions and use those resources. It's really meant. We've populated it with some information that we've been gathering, and we'll continue to do that through the channels that we receive information. But it's really meant to be a member-to-member place where you can share, not just a hierarchical mass TLC out to you, but really an opportunity for you to connect. Incidentally, it also enables you, in the beginning, there won't be people there, because right now it's really just our staff that are in there. But as we build up the community in there, it will give you an opportunity to, if you fill out the profile, to be found and to search for other people. So you can find people with similar titles or similar industries or similar technologies, and connect directly with people through the platform. So we're pretty excited about that. And lastly, I guess I'll say we are very much a member-driven organization. For those who have participated with us, you know that almost everything we do is put together by advisory groups or suggested by members. And we want to hear from you. We've been kind of on this digital transformation journey, and we're in the process of trying to do more forums like this prior to this COVID-19 crisis. But now we're really jumping into the deep end here, and so we hope we'll get a lot of things right. I'm sure we'll get some things wrong. There's other things we won't have thought of. We'd love to hear from you, everyone on my team. Feel free to reach out to any of us if you have ideas of how we can do a better job helping connect you, helping build community, helping share ideas and information, and act together as a larger whole than we can on our own. Lastly, I'll say I just see a number of members of my team. Does anyone on my team have anything for this group before we let them go? No. All right. Well, then, thank you all for joining us. We will let you know when the next one of these is. We have a lot of virtual programming on the website, and we hope we'll see you at some of those. And we hope we'll see you in our online community in the coming days and weeks. All right. Thank you, everyone.
Thank
Bye.
you.
Thank you, everybody.